As a remote island, quality healthcare is essential to the people of Hawaii. Many communities, especially in the rural areas, do not have adequate funding or resources to give the people of Hawaii the best quality of care possible. Currently, there is only a limited number of hospitals and specialists available to combat the rising health disparities and requests for preventative and surgical care. Many medical professionals throughout the state have communicated various hurdles and ongoing problems their institutions and staff experience. We want you to know that change is coming. Our doctors, nurses, and medical facility employees not only deserve more support and resources, but they also deserve their constitutional freedoms. In addition to the lack of healthcare facilities, there is a shortage of qualified healthcare professionals and options for individuals to access the standard of care needed to ensure optimal health and wellness. Many residents allow ongoing health conditions to worsen due to affordability, accessibility, and the options available. Comprehensive solutions must be implemented immediately for the people of Hawaii. As governor, my administration will work closely with the Department of Health, hospitals, clinics, and private practices to see what areas require the most support and funding. In addition to supporting traditional Western medicines and the facilities offering those methods, my administration will also work to make alternative and integrative medicine more accessible and develop comprehensive wellness programs to help residents maintain their overall health with confidence and ease. Recruiting new doctors and healthcare personnel in Hawaii is already a challenge due to the economic and housing crisis. Forced mandates and strict guidelines have only magnified this reality. Operational funding at a state or federal level for healthcare institutions should not be based on compliance and mandates related to their employees' personal healthcare choices. Numerous healthcare professionals had to make decisions throughout the pandemic based on what was best for their safety and well-being. Many felt discriminated against and unsupported when trying to exercise their constitutional freedoms related to their personal healthcare choices. Over the last few years, the same professionals we called heroes eventually had to choose to continue their passions of service or explore new opportunities if not vaccinated. Many have expressed the extreme distress and burdens these decisions have put on their families and lives. This is unacceptable. Healthcare solutions must be available to all residents, regardless of income, demographics, or preferences related to methods or ideology. Chronic disease, obesity, and illness must be combated with the understanding that each person's choices and healing solutions related to medicine are not universal and should be protected as an essential fundamental human right as a choice. I will fight for every resident in Hawaii to have the access to the education and resources needed to have the best quality of life possible in mind, body, and spirit. Change is coming. It's time to huli and strengthen the healthcare system.